Thank you. So hi everyone, my name is Nina and I am currently a postdoc researcher at the University of Minnesota, where I also got my PhD in bioproducts and biosystems science, engineering, and management. And today I'm going to be talking about my research on the air quality related health impacts of food. Oh, sorry about my cat. Okay, there. So before we talk about the research, a bit about me. I'm interested in food because it sits at the intersection of so many issues that people care about, like climate change, food security, economic development. And this interest in food really led me to pursue a PhD program in the bioproducts and biosystems engineering department at the U. And this program allowed me to develop an interdisciplinary understanding of food, the environment, and human health. It also allowed me to do some really cool things, like I was able to attend the United Nations Conference of the Parties in Katowice, Poland in 2018. I was able to lead a graduate cohort program focused on food and climate change with the Institute and the Environment. And I got involved with some local organizations like TC Food Justice, Minneapolis Global Shapers, and MN350. So that's me, and now on to the research. There is growing recognition of the complex relationships between our food system and the broader socio-environmental system that's increasingly being reflected in policy and research. Policy frameworks like the UN Sustainable Development Goals highlight the importance of advancing both food security and environmental sustainability. At the same time, we have a broad range of studies that have established the impact of the food system on climate change, on land, energy, and water use, and on biodiversity. Less is known about the role of the food system in reducing air quality. And this is despite air pollution exposure being the largest environmental risk to premature mortality in the US and globally. Of all air pollutants, fine particulate matter is the strongest. Oh, sorry, did I echo? Okay, I'll just continue. Fine particulate matter is the strongest predictor of air quality related mortality, the long-term exposure to which is strongly linked to heart disease, to stroke, and to cancer. Fine particulate matter, or PM2.5, can be formed in two ways. Primary PM2.5 is that which is emitted directly into the atmosphere. So think of dust from tillage. While secondary PM2.5 is that which forms in the atmosphere as a result of chemical reactions involving precursor pollutants like ammonia, nitrogen oxide, sulfur dioxide, and volatile organic compounds. Today, the US agricultural sector emits about 20% of primary PM2.5 and 80% of ammonia from human activity. So just as a note, in the future, when I say PM2.5, I mean that as the total of primary and secondary PM2.5, unless I say otherwise. In the US, air pollution kills about 100,000 people per year, of which about 1/5 can be attributed to emissions from the food and agricultural sector. Air quality related deaths from food and agriculture are comparable to those from transportation, to electricity production, yet the food and agricultural sector is much more lightly regulated and less studied in comparison. But as food production practices intensify and expand to meet the growing demands of an increasingly affluent and large population, it is important that we conduct research to advance understanding of the air quality related health impacts of food production so that we can improve health outcomes in the future. To date, research in this field has estimated the air quality related health impacts of food and agriculture in pretty coarse resolution. So our work seeks to increase the spatial and source detail of such analysis. Specifically, we want to link the air quality related health impacts of the sector to individual foods and diets, And two, we want to identify and evaluate producer and consumer side solutions so that we can improve air quality related health outcomes. We achieve such goals by adopting an air quality modeling framework that follows the causal chain of emissions to PM 2.5 concentrations, and finally to exposure-driven deaths. And we integrate this approach into a life cycle framework. We begin our analysis by obtaining county-level emissions from the EPA's 2014 National Emissions Inventory. We obtain emissions of primary PM 2.5 and secondary PM 2.5 precursors, as they are linked to the on-farm production of crops and livestock, specifically livestock waste management, tillage, fertilizer application, and so on. And as we can see here, most of these emissions are released by livestock waste management and by fertilizer application in the form of ammonia, as well as from tillage in the form of primary PM 2.5. Here we see the spatial distribution of emissions, and the figure shows that emissions are primarily concentrated in areas of high agricultural production. So along the US Corn Belt, in California, where we produce a lot of dairy, grapes, and almonds, Pennsylvania, where we produce a lot of dairy and eggs, and in North Carolina, where we produce a lot of pork. We then take those county level emissions and we plug them into three reduced complexity air quality models, specifically INMAP, EASIER, and AP3. These models, they leverage simplified representations of atmospheric chemistry and physics to estimate how emissions of pollutants impact PM 2.5 concentrations via transportation and dispersion by winds, chemical transformation, and atmospheric removal processes. And then based on changes in population-weighted PM 2.5 concentrations, the reduced complexity models then apply concentration response functions to estimate the resulting annual premature deaths. We chose to use these three reduced complexity models because they are less resource intensive compared to traditional chemical transport models that are more traditionally used in air pollution analysis, and because they predict marginal costs at a higher resolution compared to other existing reduced complexity models and over the entire continental US. Each of these models also adopts different structures and different simplifying assumptions. And this reduces the likelihood that all three models are making the same type of error. When I input the county level emissions into the three RCMs, I find that the premature deaths estimated by each model are pretty comparable and average to about 17,900 deaths per year. Like emissions, we see that the resulting deaths are mainly attributable to ammonia and primary PM 2.5. This figure really shows that most of the air quality related health impacts of agriculture are attributable to secondary PM 2.5, but they're less so driven by these other precursors like nitrogen oxides, sulfur dioxides, and volatile organic compounds. Here we see the spatial distribution of the air quality related deaths, and it's pretty similar to emissions. They're concentrated in areas of high agricultural production, but they're also pretty high in places where emissions are upwind of dense population centers. In addition to population density, the air quality related health impacts of agriculture, they also vary according to site-specific production practices, atmospheric chemistry, and transport. It's important to note that these maps, they don't show where people are dying, but they show where emissions that contribute to people dying somewhere in the US are from. So here we see that the top 10% most damaging counties are responsible for nearly half of the total air quality related deaths of agriculture. And again, these counties are mainly located in California, in Pennsylvania, and in North Carolina, along the upper Midwest Corn Belt. So here I show the air quality related deaths by agricultural process. And again, like emissions, we see that air quality related health impacts are mainly driven by livestock waste management, fertilizer application, and tillage, and less so by this other group of agricultural processes. I then allocated these 17,900 deaths to the commodity that is the on-site source of emissions. So for example, if we're talking about emissions linked to fertilizer applied to corn, we want to attribute that to corn. And there are generally two ways that I do this. The first way relies on using source classification codes that's kind of embedded in the 2014 National Emissions Inventory. And I use this method for emissions linked to livestock waste management, ancillary livestock deaths, tillage, and field burning. But I should note that emissions associated to the land application of manure are allocated to the crop systems that they are applied to using USDA crop production data. And then we have the second bucket that relies on supplementary data sources to make allocations. So for example, fertilizer application emissions are allocated in proportion to crop acreages from the cropland data layer that's paired with crop-specific nitrogen volatilization rates that are obtained from the model that we use to estimate fertilizer emissions. The use of agricultural equipment, the emissions from those are allocated according to crop acreage data from the cropland data layer. And then fertilizer production and pesticide application emissions were attributed according to fertilizer and pesticide use data from the USDA. So I then used commodity usage data sets published by the USDA to allocate commodity emissions along the life cycle of its final product, whether that be an animal-based food, a plant-based food, or a non-food product. In total, my analysis accounts for 95 agricultural commodities and 67 final food products that cover over 99% of agricultural production in the US. The 67 final food products belong to 11 food groups as seen here, and the numbers in parentheses correspond to the number of food products I have within each food group. So here I categorize the 17,900 deaths by pollutant, by process, by commodity, that is the on-site emission source, and by the final product. The colors signify whether the damages are linked to a final product that is an animal-based food, which is in pink, a plant-based food, which is in green, or a non-food product, which is in blue. We've already kind of gone through the first two columns in the previous slide, so I'm going to skip ahead to this third column. And for this column, we find that air quality related health impacts are really concentrated in a few crop types like corn, fodder, and soybeans, and a few livestock types like cattle, swine, and poultry. When we compare the air quality related health impacts attributed to crops versus livestock in this column, we find that they're pretty comparable. But as we move to the fourth column where we make those life cycle attributions, we see that a substantial portion of the crops are used as animal feed and non-food products. So for example, like corn, very little of it is actually consumed directly for as human food. Much of it is fed to cattle, to pigs, to chickens, or is used as biofuel. So we find that of the 17,900 deaths from agriculture, 15,900 are linked to food production. And of that 15,900, we find that 8% are linked to animal-based foods. I then compute the per unit air quality related health impacts of each food and aggregate them by food group. So the per serving impacts, which is what's here on the bottom left, show that the air quality related health impacts of red meat are 2 times those of eggs, 3 times those of dairy products, 7 times those of poultry, and at least 10 times those of nuts and seeds, and at least 15 times those of all other plant-based foods. Similar trends hold when we compare the foods using the other 3 metrics, so per kilogram, per protein, per kcal. And I find that even the lowest impact unit of red meat has greater impact than the highest impact unit of production of any other food. This is except for non-meaningful comparisons, like comparing red meat to fruit on a protein content basis. We then use the per unit damages of foods to build the air quality related health impacts of national dietary scenarios. So these diets are all derived from the Eat Lancet Commission, which builds diets on an isocaloric basis while accounting for national preferences of different food groups. For those that are less familiar, the flexitarian diet the flexitarian diet or the planetary health diet. It's a diet composed of greater portions of whole grains, of fruits, of vegetables, nuts, and legumes. Meat and dairy are still included in this diet, but in smaller portions. And here we see that shifts to diets that contain greater portions of plant-based foods, and specifically reduced portions of red meat can substantially reduce air quality related deaths. Here, I estimate the air quality related health benefits that can be achieved through readily available solutions to producers and consumers. They largely target ammonia because it is such a large driver of air quality related health impacts in the agricultural sector. But specifically, we focus on interventions that target livestock waste management, fertilizer application, tillage, yield burning, agricultural fuel combustion, dietary shifts, food loss and waste, and per capita consumption levels. And we find that improvements in agricultural production, such as changing livestock feed practices or using fertilizer amendments and inhibitors, can greatly reduce the air quality related health damages of the food system. Implementing measures to reduce agricultural emissions across all producers could prevent half of food-related deaths. So that's what we see here. And nationwide dietary shifts that decrease consumption of animal source foods can also lead to large benefits in air quality related health impacts. For example, substituting red meat for poultry can avoid 40% of deaths, and even more ambitious shifts to the flexitarian, vegetarian, and vegan diet would result in even greater air quality related health benefits. Other demand-side interventions, such as shifting caloric intake to be in line with metabolic requirements and decreasing household food waste, would lead to more modest reductions in air quality related death rates. So the key findings from our work are that there are 17,900 annual deaths from agriculture-related PM2.5, of which 15,900 can be linked to the food production. 80% of those 15,900 deaths from food-related PM2.5 can be attributed to animal agriculture. On average, the PM2.5 related health impacts per unit of animal source foods are greater than those of plant-based foods. And there are many consumer and producer side interventions that can substantially improve health outcomes. We published our work earlier this year, and we were very fortunate to receive the attention of major media outlets. And in the future, we hope to extend our work to explore more how the things that we do to improve the air quality related health impacts of the food systems are accompanied by synergies and trade-offs to other social and environmental impacts, as well as to extend our analysis to the global scale. So thank you so much for having me. I'm happy to answer any questions anyone might have.
Okay, thank you. Thank you so much, Nina. Can you guys hear me? Can you hear me?
Yes, we can hear you.
They can. Okay. Oh, can you turn off your volume? Okay. So we're having some pretty serious technical difficulties here. So I'm going to try to facilitate this with only a little phone in front of me rather than a computer. But maybe, Nina, you can answer the first question that came up from Simon here, which is how do air pollution from synthetic fertilizer compare to the air pollution that occurs from using manure as an organic fertilizer? While you answer that, I'll try to get my computer back up and working.
Yeah, that's a great question. So I guess per unit, we haven't looked into that actually, but if we just look at overall numbers right now, the air quality
turn up your
related health
volume?
impact. Oh,
Yeah,
sorry, can you hear me?
yeah, we can, sorry.
No, you're okay. Yeah, so we haven't done a per unit comparison yet, but overall, we are seeing that the air quality related health impacts from synthetic fertilizer are greater than those from manure.
Great, thank you so much.
Yeah.
Okay, I think we're good now. And maybe you could talk a little bit about the emissions from biofuels. Are those the emissions from the biofuels being used, or just the emissions from the biofuels being produced? So are you looking at emissions across the supply chain or just on the production side of things?
Yeah, so this is just the on-farm production of biofuels. There would be additional, oh, sorry. There would be additional emissions associated with using biofuels.
Okay. This is horrible, guys. I'm so sorry. I'm trying to operate on 2 different computers and it's not working very well as we cross the computer barrier.
Sorry to interrupt, Kim, but you actually sounded great just then. So whatever you're doing now, maybe just keep it as is.
Yeah, should I just move on to the next question?
Okay, so Nina, I'm so sorry about this. We've got a multiple device issue. So I guess in terms of how we think about attribution of these emissions to different sources and who is impacted by them, is the fact that air pollution is not static and travels across national and state boundaries. Does this present a challenge for future research, or is it essentially an issue that needs to be addressed at the federal level, given the way that air pollution can move around?
Yeah, that's a great question. So right now, the Clean Air Act does regulate some criteria pollutants. Ammonia is not one of them, but my understanding is the way it works is it works with states to develop state implementation plans on how they can reduce emissions of air pollutants. Farms are tricky because they're non-point sources, so it's a little trickier to monitor them and regulate them. And I think right now, I mean, it is also what you're saying, that it travels across state boundaries. And so like emissions from one state could flow into another state. That's a good question. I think you're right in that we do need like federal coordination or, interstate coordination to ensure that emissions in one state aren't like flowing into another state and there's nothing that affected state can do about it. But even locally, I think we are finding that, certain populations are more impacted by air pollution than other. And this is kind of beyond agricultural air pollution, obviously, but we do see that people, populations of lower income and communities of color are more affected by air pollution than wealthier people and, white populations as well. Sorry, did I answer that question?
Yeah, I think so. And I think that actually brings up a topic that we've been talking about in our class this week, which is that, of course, there's a lot of research that has come out in the last year or so showing definitively that non-white populations are more significantly affected by all sorts of air pollution. What's the driver? So when we look at like urban areas, often the driver of that has been redlining and other sort of structural zoning approaches that have led to an overlap between air quality problems and non-white populations. But how is that true in the agricultural sector? Maybe you could speak a little bit to the distribution of emissions in the agricultural sector and how what you found sort of maps on to different ethnicities and populations and poverty levels, or maybe you haven't looked at that, but I'd love to hear your thoughts on that.
Yeah. So examining the air quality related health impacts of agriculture and different socioeconomic groups is something that's kind of beyond our analysis at this point. I think there are other papers that breaks like the air quality related health impacts of different economic sectors across different socioeconomic groups that shows that agriculture is kind of the exception to that rule. But obviously, it also depends on the commodity that you're looking at, because I think a lot of, not CAFOs, but swine production systems are very concentrated, like in North Carolina. And this is not my analysis. This is just like another analysis that I've read. But those disproportionately impact like Black and brown populations. And I think there was a similar analysis that said the same was true for like field burning of sugarcane in Florida.
Okay, that's helpful. So to get to the questions that have been put in the question and answer here again. So, and this is something that I was wondering as well. So Eli asked whether there's an effective way to reduce these emissions without cutting out all meat production, or I would say meat consumption, since that's why we have meat production. And to build on that, I think if you look at that set of options that you have, right, you have all these different options for mitigation. Some of them actually aren't very impactful, but maybe can be done through policy change and sort of USDA grants and things like this. Could you sort of map your feelings about the likelihood or the cost of each of these interventions compared to their benefit? And based on that, which one seems to be where we should focus our efforts?
Yeah, sure. So the air quality related health impacts of agriculture are very like driven by ammonia from fertilizer application and from livestock waste management. And for those two things, there are a lot of things that we can do on the production side to, meaningfully reduce their impacts. We can, for fertilizer, we could switch to less emissive fertilizer types. We could apply it more deeply into the soil. We could time it better. For livestock waste management, you could change the feed of the animals, although I think there might be some like trade-offs with the climate impacts for that. You could install tree shelter belts. You could install scrubbers to like prevent the air pollutants from getting out into the atmosphere. Or you could install like the flooring of their housing system so that it collects and contains the manure more quickly and doesn't allow the ammonia to volatilize as quickly. I think other analysis I've seen, like cost benefits analysis, show that the air quality related health benefits do greatly outweigh the costs. It just depends on who pays it, because the farmer might pay the cost and then the benefits is to the public. So you would need like some sort of public program to support like farmers making more environmentally sustainable decisions. Like the economic benefits to public health, they don't come back to the farmer on their own.
Great. Thank you for that. So Simon asks sort of specifically about regenerative agriculture. I mean, I think that certainly within at least our sort of environmental studies community, there are a lot of folks that have plant forward diets or even vegan diets, but I think broadly across the United States, that's in the short term not really attainable. So is regenerative grazing and practices like silvopasture, are those within the livestock sector and a mechanism by which you could achieve some of the mitigation? Or what are your thoughts on specifically regenerative grazing approaches?
Yeah, I can't say too much about that because we didn't model it. I do know like grazing could help reduce the livestock waste management emissions of it. But meat is, especially like red meat, is tricky because there are two essential like bad drivers of like any environmental impact associated with meat. Usually that associated with like the livestock waste management, and there's also just the amount of food that you have to put into an animal to get, you know, some unit of food out. They're just like nitrogen wise, they're very inefficient in using it. I think there's a number from another paper that says like 40 to 80% of the nitrogen that we put into a cow is actually excreted. And so that is to say, like, increasing grazing time of cow will reduce their livestock waste emissions by little, but it's just not a leverage point as switching to a plant-based food that kind of tackles both the livestock waste management emissions and the fertilizer application emissions, because you're bypassing that inefficiency.
Thank you. So in terms of, if we think about the overlap between climate mitigation strategies and air quality emission or air quality mitigation strategies, it seems like there is actually a huge confluence in that area. And the US has historically been much more effective at improving air quality through policy than we have been at addressing climate change related issues through policy. So what do you think the role of your research and your findings is in supporting or driving changes to sort of climate policy as well, or the ability to address emissions like methane from livestock, as well as some of these other types of emissions that directly impact people's health through, breathing and interaction with that air?
Yeah, no, I think that's a good point. I think the US has been very effective in reducing levels of nitrogen oxides and sulfur dioxide. I guess I can't say too much, but I'm not sure the same is true for ammonia and on-farm emissions. I think a lot of the times they set thresholds that on-farm emissions don't meet, so they're essentially exempt from air quality regulation. I think maybe Europe, they have like the Convention on Long-Range Transboundary Air Pollutants and the Gothenburg Protocol, and those have been more effective in reducing the ammonia emissions, either through promoting alternative fertilizer uses and or just providing more financial incentives for improved nitrogen use efficiency. And those do come with climate benefits. I'm not sure the same is true for the US at this point.
Yeah, I guess I was thinking criteria pollutants, not necessarily agricultural pollutants. And indeed, there are within the agricultural sector exceptions for some of our criteria pollutants. So I guess this is more of a technical question, but could you talk us through how ammonia is converted to PM 2.5, so particulate matter? Like, what's the mechanism there? And let's see, let me read the rest of this question.
Sure.
And is the PM 2.5 created from ammonia more injurious than primary PM 2.5? Are they essentially the same thing, or do we not know enough about the physical differences and their impacts on our health to be able to incorporate that into models?
Sure. So I can talk a bit about, so how that works is we feed nitrogen to a cow, some of it gets excreted, that nitrogen decomposes and ammonia volatilizes into the atmosphere, and that ammonia will have to react with sulfur dioxide sulfuric acid and nitric acid to form PM 2.5. That's a good question on like whether the composition of the PM 2.5 affects like its how harmful it is to human health. And at this point, the EPA regulates PM 2.5 on a mass basis because we don't know well enough how the toxicity levels of different mixtures of PM2.5 affect human health? And then, sorry, there was a second part of your question that I don't think I answered.
Yeah, it was just basically how physically does ammonia become TM2.5, but it just like the physics of that, or the atmospheric interactions of that.
Yeah, so ammonia can react with sulfur dioxide or nitrogen oxides to form, it's an acid and a base forming PM2.5. But first, the nitrogen oxide has to become nitric acid, and the sulfur dioxide has to become sulfuric acid. And the ammonia will first primarily react with the sulfuric acid to form PM2.5. And then once that runs out, it will react with the nitric acid to form PM2.5. And because we've, like the US has lowered NOx and SO2 levels so significantly in the past couple of years, PM2.5 formation in the US is more sensitive to ammonia emissions than in other countries where NOx and SOx levels are both still pretty high.
That's super interesting. I think I'm running out of questions here in the chat. I mean, I could ask more of my own, but if anybody else in the audience has questions that you'd like to ask, maybe Annie, if you speak really loudly, I'll give you my phone.
Hello. So thank you for your presentation. I have a question just more so on, in general, I know you spoke a little bit about your introduction and background into why agriculture and whatnot, but I'm just curious if you have any information on how the kind of research that you're doing, so tying in agricultural production and air pollutants, is related and or being done in these communities, like in agricultural based curriculums in certain colleges, because I know that, yeah, I'm just curious as to whether the people that are going back into these communities that go to these like agricultural based schools are also, I know that they're thinking about these things, but whether or not that you've had any interactions or ability to interact with them. So yeah.
Yeah, that's a great question. So prior to recent studies, the air quality related health impacts of agriculture has really been limited to very coarse resolution analyses. So very difficult to incorporate into like ag extension work. But in Minnesota, at least I can say like increasingly we are seeing like more grant funding that helps us better study how specific crop systems affect air quality. And that does allow us to work more with like ag extension folks and farmers to improve, well, just to help them make more informed decisions on their farming practices. Outside of Minnesota, I can't say too much, unfortunately, sorry.
Okay, thank you. And I think certainly at the University of Minnesota, you guys are a land-grant university. So part of the the remit of that university is in fact to work directly with farmers, which is something like NYU doesn't do. So our students, that's a different way that the university functions. So I'm actually out of questions in our Q&A. So I think at this point, Nina, I'll ask you, what are your next steps? Like you talked a little bit briefly about your future research, but maybe you could expand on that a little bit, and then we can give you some claps and wrap it up.
Yeah, no, so right now our lab is working on moving more towards like extending our analysis to the global scale, as well as understanding better what the synergies and trade-offs are in terms of like air quality versus climate versus water quality. And I think for me personally, I'm still trying to think about like what research can I do that would really make an impact. And for part of it, it is that synergies and trade-offs work that I'm really excited about, because none of our work exists in a vacuum. Things we do, you know, to achieve one goal does have like effects on other like social and environmental goals. So that's really exciting to me. I think to what one of the students, I'm sorry I didn't get your name, but was asking is, I think it'd be really interesting to work more with like the actual stakeholders that do this work and that, you know, better understand like what the barriers are to adopting some of these practices and can help us, you know, can give more nuance to our localized context on what's actually happening in that farm, how can we improve our models, and how can we better assist them in adopting these like environmentally sustainable solutions.
Okay, well, thank you so much, Nita. Sorry for all the technical difficulties to you and our audience, but we really appreciate your thought and your time and the knowledge you provided to us. So it'll be really exciting to see what you guys do next with this type of information. So thank you so much. And well, this is the last environmental studies seminar of the semester, but we'll have some more in the spring semester.
Yeah, for sure. Thank you for having me. And if you like, if I didn't answer a question very well, or you have a follow-up question, please feel free to reach out to me. I'm happy to answer.
Thanks, we'll do that.